Hi, my name is Jaylou Velez Torres, and I'm an assistant professor of pathology at the University of Miami. And today I will be discussing our new project. So what we decided to do was to explore different metric tools to measure the performance of our laboratory and each individual cytopathologist. And so we decided to explore the AUS to malignant ratio versus the ThyroSeq version 3 positive call rate. When we analyze the result of this data, what it shows is that the AUS to malignant ratio is increased for the laboratory, but the positive call rate is normal. You can see that as a laboratory, we are overcalling benign nodules as AUS, and we, at the same time, are undercalling higher risk lesions such as follicular neoplasms or suspicious for malignancy as AUS. The next metric we used was the MD-ROM. When you analyze the data, the results show that the laboratory has an increased AUS to malignant ratio and a slightly lower MD-ROM. You can see that as a laboratory, we are overcalling benign nodules as AUS. And the next metric is the AUS versus the risk of malignancy. It shows that the laboratory is undercalling higher risk lesions such as follicular neoplasm and suspicious for malignancy as AUS. We found that it is important to combine different metrics to evaluate different differences in diagnostic practices, and by dissecting each of these practice patterns of each individual and the laboratory, we can measure different aspects of performance, and that way we can provide individualized feedback to eventually be able to reach our target and our goals. Thank you so much for listening.